I'm Dr. Bob Arnott, both a physician and a patient. As a weekend warrior, I've torn my rotator cuff, dislocated both shoulders, and developed severe arthritis in my hips and knees. Here you can see me hobbling through the streets of Mogadishu, Somalia in my TV show, Dr. Danger. Even on high doses of NSAIDs, I still hobble. Probably the last place you want to hobble given the number of guns on the street and the need to move out of the way quickly. Like so many patients, I ran enormous risks by taking high levels of NSAIDs like ibuprofen.
The side effects of NSAIDs are it can affect your stomach, cause GI bleeding, can affect your renal function, and they cause fluid retention, so there's cardiovascular side effects to the NSAIDs from those conditions.
Why? NSAIDs work here in the arachidonic acid pain cascade pathway, blocking an enzyme called cyclooxygenase. That's good news since blocking COX-2 can ease the pain by decreasing the production of prostaglandins that cause inflammation, pain, and swelling. However, NSAIDs block the production of COX-1. COX-1 produces eicosanoids which help protect the lining of your stomach from erosion. Chronic use of NSAIDs can lead to a catastrophic GI bleed. Each year, NSAIDs cause the deaths of 16,500 Americans and hospitalize 107,000 others. Ibuprofen also allowed me to destroy my hips, covering up all the warning signs and allowing me to run through the pain. The arthritis finally got so severe I had both of my hips resurfaced. I still have severe arthritis of my patellar femoral joint. The knee arthritis was so severe that I couldn't kneel, nor could I bend my knees to ski, surf, or bike. I also knew that NSAIDs would just make matters worse, so I looked at an alternative way to get medications into the tendon and the joint. I apply the cream over the joint, rubbing it for 2 minutes. The base cream helps transport medications across the stratum corneum. Cartilage, tendon, and bone have a limited blood supply, so taking medications by mouth requires large doses and high serum levels to get very modest levels into the tissue. Pain in osteoarthritis comes from these nociceptors, which are localized densely in subchondral bone and become more exposed as cartilage is destroyed and become more painful. They are sensitized further by inflammatory mediators and may increase in number. The pain of osteoarthritis is characterized by increased responses to painful stimuli and pain from a stimulus that is normally not painful, and pain that is not responsive to standard therapies. But with transdermal therapy, high doses of multiple different medications can be transported right to where it hurts most. Studies show much higher concentrations of medications delivered transdermally in the joint than orally. On the COX side, diclofenac decreases COX-1 and COX-2 production, which reduces the production of PGE2, the most powerful modulator in the body. On the LOX side, Translast inhibits the production of IL-1 and TGF-beta, while pentoxifylline is a potent inhibitor of TNF-alpha production, a highly inflammatory immune modulator which accelerates all inflammation. The total effect is to sharply decrease the number of modulators produced from both the LOX and COX side and released from white blood cells so that far fewer bathe the nociceptor and the threshold for firing increases as a result. After a few weeks using this preparation, my pain disappeared. I was able to return to highly competitive bike racing, stand-up surfing, ski racing, heli skiing, and rowing. I now have a full range of mobility and am pain-free. With transdermal therapy, I have high tissue levels of powerful medications to cut my pain and decrease the inflammation, but with small serum levels, putting me at low risk of a complication. As medical practitioners treating patients with osteoarthritis, transdermal therapy gives us a safe and highly effective choice when compared to oral NSAIDs. You can learn more by visiting the Transdermal Therapy website. Thanks so much for watching.